Spermicide is a type of family planning method that most people are not aware of. You may want to ask, what is spermicide? What are the side effects of spermicide? How effective is spermicide? What are the advantages? What are the disadvantages of using spermicide as a family planning method? And this video is going to explain everything about it. Good day everyone and welcome back to Nurses Lecture Room YouTube channel. My name is Mercy Mary, popularly known as the Nurse with a Difference, and I make learning easy and accessible for all my viewers. Today we're going to be talking about spermicide. What is spermicide? What are the types, the various forms of spermicide, the advantages and disadvantages of using a spermicide, and also the side effects of using a spermicide. But the first thing we're going to be talking about is what is spermicide. Spermicide is a chemical that actually prevents the sperm from getting to the egg. And you know that when the sperm does not get to the egg, there's no way fertilization can take place. There's no way a baby will be formed. There is no way an embryo or a zygote will be formed. For an embryo, a zygote to be formed, the sperm has to get to the egg. So what spermicide does is to make sure that the sperm does not get to the egg. There are different forms of spermicide. There are some that comes in cream, gel, foam, and also some come in suppository and some thin film. All right, so these various forms, all they do is to prevent the sperm from getting to the egg. The next question you want to ask is, how does this work? How do they go about it? How do they prevent the sperm from getting to the egg? The first thing this spermicide does is to block the cervix. It's more or less like it's closing the cervix. And you know the cervix is like the opening of the vagina. So when the cervix, opening of the uterus, so when the cervix is closed, the sperm cannot go up, the sperm cannot get to the fallopian tube. The sperm cannot travel down. So that is one of the mechanisms of the spermicide. Then another is that it slows down the sperm. You know, the sperm was working very fast before. So that spermicide actually slows it down, makes it very slow, makes it very difficult for it to even get to the egg. There's something I want you to take note of is that spermicide are usually used alongside with some other family planning methods such as condom. Most times, it is not advisable to use spermicide alone because it is not 90% effective. It is not 100% effective. Spermicides are 70% effective. So out of 100 couples that actually use this spermicide, 28%, 28 of these couples actually report having an accident and getting pregnant. So spermicide is only 70% effective. So that is why it is advisable for you to use spermicide alongside with some other family planning method. Now let's go back to how it works. Like I earlier said, it blocks the cervix and it also slows down the sperm. Remember I said that it comes in different form. For the ones that come in form of a cream, in form of a foam, and in form of a gel, what you just need to do is to squirt it down deep into the vagina. You squirt it into the vagina. While for the one that comes as suppository and also the thin film, you have to put it at the back of the vagina, deep down at the back of the vagina. So be it the cream, the gel, the suppository, and the thin film, is advisable you place it before sex. All right, you don't put it at the heat of the moment. It's not going to work. So you have to place it before sexual intercourse, like 10 to 15 minutes before sex. So if you know you want to have sex as a woman and you don't want to get pregnant, spermicide are used 10 to 15 minutes before sex. And also after 1 hour, it actually elapses. You have to reapply again. You get? So if you're going to have sex hours later, you reapply the spermicide again. There's something you need to know. It is placed 10 to 15 minutes before sex to allow it spread and take effect before sexual intercourse. And for the ladies, you don't have to douche 6 hours, within 6 hours after using it. So after 6 hours, you can douche, you can use your fingers and do anything you want to do. But within 6 hours, it is not advisable you douche while using the spermicide. So now that takes us to the side effects associated with the use of spermicide. In terms of the side effects, one of it is that it can cause irritation of the vagina and the skin around it. Then the second one is that you have an increased chances of getting urinary tract infection and also sexually transmitted infection. Spermicide don't prevent STIs, they don't prevent STDs, unlike condoms. All right, so spermicide does not have anything to do with prevention of STDs and STI. The next question you may want to ask is, who can use the spermicide? As far as you are a woman, you can actually use the spermicide, except that you are allergic to the materials, to the constituents, to the chemicals used in making spermicide. Then the next question you want to ask is, when should I contact the doctor? So if you use the spermicide and you are suspecting you are pregnant, it's advisable you see the doctor. If you notice any smell or discharges abnormal from the vagina after using the spermicide, it's advisable you see your doctor. If you're having pain during sex after using the spermicide, you can see the doctor. If you're having belly or pelvic pain after using the spermicide, kindly see the doctor. And also, if you're having rashes around your vagina while using the spermicide, kindly see your doctor. If you have pain while peeing or while trying to pee or during the process of peeing, it's advisable you speak with your doctor. All right. So spermicide does not cause harm, or if you see any of this, it's advisable you speak with your doctor. Then that takes me to the advantages and disadvantages of using a spermicide. In terms of the disadvantage, one of it is that it is inexpensive. It is not expensive. And also, you can get it over the counter, you can get it in your supermarket, you can get it in your pharmacy. And another thing about spermicide is it can also be used as a lubricant. It can serve as a spermicide and also a lubricant. And we all know that lubricant helps to reduce friction during sex and also increases pleasure. So spermicide can have both function. So another benefit of using spermicide is that it does not contain certain hormones. So it's not going to alter your hormonal structure, or it's not going to cause hormonal imbalance. You know, some of all these plants, implants and other family planning methods, they contain some hormones that are likely going to increase this and decrease that. That is quite different. So then that takes me to the disadvantage of using spermicide. And one of it is that spermicide does not protect you from sexually transmitted infection. And another is that it can cause irritation and tear in the vagina and the skin around it. And another is that it has to be reapplied each time you have sex. Unlike the other family planning method, for example, your implants, your medications you take, you don't have to reapply it or take the medication anytime you have sex. But for spermicide, you have to reapply anytime you have the mindset of, I want to have sex. So it's not something that you want to do a quick one, you just go and have sex immediately without applying the spermicide. So you have to plan it, more or less like it's used for a planned sex. You have to plan it, you have to apply it and give it time to work before you have sexual intercourse. So that is that about spermicide. And for those that are asking if you can swallow the spermicide, no, you can't swallow the spermicide, be it the suppository form. All of the spermicide you have to insert through the vagina. So the men are not expected to put it in their penis. No, the women are the ones that are supposed to put it. They are supposed to squirt it or to insert the film into the vagina. So this is basically what I have to share with you today in regards to spermicide, and I hope you got value. Thank you very much for staying tuned. Thank you very much for watching this video. Don't forget to like, don't forget to subscribe, and also don't forget to share with a friend if you got value. For all my returning subscribers, this is Nurse Messi saying thank you. Bye and see you in our next video.